Hi, Dr. Pryor here with Pryor Health. I'm here with Laura and Dr. Sood, and we're here to introduce the Pryor Health Center of Excellence for Breast Implant Illness. And as most of you know, I've been doing a lot of breast implant illness work over the last few years, and I've really kind of built up this Center of Excellence, which by definition I'm calling the combination of research, education, and clinical outcomes, all that we do here at Pryor Health. And part of that is bringing on amazing, talented surgeons to keep up with the great outcomes, clinical outcomes that we see in our patients that are getting treated for breast implant illness with explant surgery and capsulectomy to maximize their potential to feel better after surgery. And so Dr. Sood is a very experienced board-certified plastic surgeon that we've been working with here at Pryor Health, alongside with our breast implant illness advocate, Laura. Why don't you just tell us a little bit about yourself for starters?
Well, first of all, it's a privilege to be part of this program here with Dr. Pryor and Laura. I feel like they both kind of brought me on, and it's been an interesting experience. For about a year, I've been doing explants almost exclusively here at Pryor Health. I'm a board-certified plastic surgeon, originally trained to do everything head to toe, and over time kind of slowly started learning about breast implant illness and kind of seeing some of the problems some of our patients are facing. At this point I've done hundreds of explants, including lifts and some ancillary procedures, but what drew me to this was the fact that the patients actually kind of needed something rather than just wanting something. It's a little bit different compared to how my aesthetic practice used to go, and it kind of helps me to kind of stay grounded, and it's actually it's very rewarding to have these sort of outcomes with patients and these sort of interactions. I really enjoy the patient population, and it's something I've grown to love, and it's something I will continue to do. And our goal is to optimize outcomes and through clinical research, through meetings, through all sorts of presentations, we hope to actually optimize every single aspect of BII, and we hope that our center is the center of choice for most of the patients in the Midwest and the US.
Yeah, I think just to comment on what Dr. Sood said, we are probably the premier, if not the only center of excellence, so to speak, that is doing this, total comprehensive approach to breast implant illness, if not in the Midwest, in the country. And I think one of the reasons, like Dr. Sood said, I enjoy it, and the way I explain it to patients and to people that are looking to understand breast implant illness is it's really more of a reconstructive surgery, right? So as plastic surgeons, Dr. Sood and I went into this profession to help patients, feel better. That's kind of at the crux of what we do. And so when you're doing aesthetic plastic surgery, it's done through the lens of helping patients look better. Reconstructive surgery is really, designed to help with patients, quote unquote, function as opposed to form. So, while we're typically in our, busy aesthetic practices helping patients look better so that they can feel better, this breast implant illness type of surgery is much more akin to doing a reconstructive surgery for patients that are coming in with a real medical condition that's debilitating, that's requiring additional surgical intervention, regardless of whether it's breast implant illness, breast cancer, cleft lip, traumatic deformity, all these types of things that we do as plastic surgeons to help patients just have a better quality of life. And that's really what we're trying to achieve with patients that have breast implant illness. And that's, really where the reward comes in for us as plastic surgeons. And it's great that we like to help patients, feel better by looking better too. But, when we're able to really change somebody's quality of life for the better, and see how dramatic that improvement is, and see how it really kind of ripples through their family, through their community, through their ability to perform, their job functions. I mean, it just is a whole nother level of, really being grateful for being able to help these patients. And, it's rare to be able to find talented surgeons like Dr. Sood that can not only understand kind of what we're doing with breast implant illness, but be able to execute a very successful surgery, which is not an easy task. It actually is a challenging surgery to do correctly. That's why we've got the team in place to not only maximize the clinical outcomes, but making sure that the patients are treated holistically for any other related conditions, emotional, psychological, nutritional, just general wellness, so that we can get the best possible outcomes for them. And so I guess with that, I'm curious to hear Laura's feedback, and she's trying to hold the tears back. So
he can feel it. Obviously, he knows me well enough. So I'm going to take my advocate hat off for 1 second, which is what is probably going to make me cry. But I want to thank you, Dr. Pryor, for bringing Dr. Sood on. I think it's so important in this community that we have doctors that believe us, and to have a team that is so incredibly supportive of the BII community. So, I always say, you're only one person, and you can only do so much. So to have Dr. Sood believe us and come on board and have the empathy and compassion and meticulous hands to take care of this population along with you is beyond grateful. It's been a pleasure watching you work with your patients, and it's a pleasure watching you work with your patients and being in the center of that, and loving these patients and crying with these patients. And something that they had just said, it's not something they want, it's something they need. Those words are just resonate. These patients are sick. So to have somebody say, I believe you, and we're going to take care of you, and do the proper procedure, having patients travel from all over the state. Majority of our patients actually travel from out of state, which speaks volumes. It makes me sad to think that they have to travel out of state because there's not enough brave doctors that are standing up and willing to acknowledge BII, tell them they're not crazy, because they're not crazy, and do the proper procedure. And I can feel it starting. I'm going to start crying. And when he looks at me and smiles, I'm going to start crying. So
this all started Pryor and the Crier.
It's exactly almost 3 years ago. I know you said 2 years ago.
It's actually three years. So, 2018 actually.
Yep.
So
Yeah.
I said 5 years.
Well, I've known you for that long.
Yeah.
But so I am beyond grateful to bring Dr. Sood on to be able to help as many women as we can. And we're just going to keep building and to continue with our med students with research. That is huge. That is something no other practice does, that has medical students that are willing to do these studies, because we need the science behind this. I'm the science. All these patients are the science. So to have it on paper and have these studies published speaks volumes about the practice that we have.
How many medical students do we have now?
We actually
six.
we have 6, and we have somebody else that's on board.
From University of Illinois. Yep.
Yeah, and we are going to be doing another speaking engagement at the college in October, and that's where we get the interest from these students saying, hey, I've never heard about breast implant illness. And the nice thing about that, as Dr. Pryor has mentioned in the past, is we are now educating the medical students, right? And they're going to go out in the public, and they now know about BII.
Yeah, it's amazing. We did a symposium at the med school last year, maybe 2 years ago at this
We've
point.
done 2 of them, yeah.
Yeah, and that's really where most of these medical students are coming from, M1 and M2s. Those are first and second year medical students typically that want to get into either plastic surgery or competitive field, and they were unaware of breast implant illness, and listened to our presentation, and literally after the meeting, people reached out to me and to Laura and said, hey, I'm interested in getting involved. This sounds like something like really special that you guys are doing, and do you have any work that we can contribute? If there's research to be done, we'd love to participate. So yeah, we've gone through the process. I'm a assistant professor at University of Illinois, so we've gone through all of the required documentation, paperwork, IRB approval, all of the process that's required to actually do clinical research. And so hopefully within a couple of years, hopefully we'll have sufficient data that we can start publishing papers. Some have been published already on breast implant illness, but there's not that much. So hopefully we can contribute to the wealth of knowledge in the arena of breast implant illness, and get it out into the public as well as into the medical community, like these upcoming doctors, so that as people potentially develop breast implant illness down the road, they will have resources like their physicians that are educated about it and can make the appropriate recommendation to get their implants out. So if you or a loved one is suffering from breast implant illness, or you think you might have symptoms of breast implant illness, we encourage you to reach out, talk to our practice, talk to Laura, and we'll be happy to see you and help you try to feel better.